Hi there, it's Kate.
Hi.
I'm your nurse. We met briefly this morning at report.
Oh, yes.
Right, you were a little sleepy.
I
know. So I'm here till 7 o'clock, and my name and number is up there on the board if you need me when I'm not here.
Okay.
Okay, how are you feeling?
Good.
You have a good night?
Yeah.
Mostly? Good,
Yeah.
good. Okay. Are you up out of bed?
Yes.
Good. Have you gone to the bathroom and voided?
Yes.
Excellent. Any bowel movement?
Not yet.
No? Passing gas?
Yes.
Good. And is your bleeding okay?
I think so.
Not too much? You're not having to change a pad every hour?
No.
Good, okay, that's what we want. It should be kind of slowly tapering off.
Mhm.
Okay, let me just log in here into the computer. Good, can you give me your name? Hold on. Good. And I understand you're breastfeeding, right?
Yes.
Is that going okay?
Yeah, we were up every 2 hours last night.
Oh, awesome, right? Nice. But she's got a good latch?
Yeah, it hurts a little bit, but she's on for a whole 10 minutes, so.
Oh, okay, good. I mean, if you want, I can call a lactation consultant. They can come in if you want me to put that in for you.
Oh, I don't think we need it.
Okay, well, let me know if something changes. We can put that in,
Okay.
okay? And you have your IV running, is it okay?
It's kind of pinchy.
Yeah, it hurts?
Yeah.
Does it hurt up here?
No.
It hurts down here where it goes in?
Yeah.
Yeah, sometimes right there where it goes in, it can pinch a bit, but there's no pain up here?
No.
If there's nothing there and it's not red or puffy, then it's infusing okay, then we don't really want to mess with it.
Okay.
Okay? And hopefully that'll come out today anyway.
Okay.
Alright? Alright, so I need to do a full head to toe exam and check your belly and your bleeding. Is that okay to do now?
Yeah.
Good, okay. I'm just gonna put little baby over here in the bassinet, okay?
Oh, I can't hold her?
Well, I'm gonna press on your belly and everything. So let me just put her here for the moment. Now you can keep her in sight the whole time, Mama.
Okay.
And I'm just gonna put her here. There you go. See, she's right next to you. And I'll bring her back as soon as I'm done.
Okay.
Are you having any headache?
No.
Any blurry vision, changes of spots?
No.
Anything like that? Good. Okay. Is it okay if I listen to your heart?
Mhm.
Are you having any chest pain?
No.
Palpitations, feeling like your heart's beating out? Okay. Just listen here. I'm going to let your necklace. I have to listen under your breast a little bit, okay? There you go, thanks. Great, okay, I'm gonna listen to your lungs. Are you having any shortness of breath?
No.
No pain when you take a deep breath?
No.
Good, can you lean forward while I check your back? Take a nice breath in when you're ready. And another one. And again. And again. Good, almost done, a few more. I want you to hyperventilate, you okay?
I'm okay.
Another one. Give me a nice deep breath. Good, and another one like that. Excellent, good. Go ahead and sit back for me. I'm gonna listen to your belly, okay?
Okay.
Just need to listen here. Good. And are you having any pain if I press here?
No.
And how about here?
No.
And how about there?
Mm-mm.
And how about there?
No.
Excellent, excellent. Can you take my hands for me and squeeze really tight? As hard as you can. Good. Push for me. Again, so here you go. Pull. Excellent. Let me check your pulses here. Excellent. Let me check your reflex. There we go. Drop that arm. Let me hold it. There we go. Excellent. Okay, I'm going to check your bleeding. I'm going to put your head down.
Okay.
There we go. If you can just bring your shirt up for me a little bit. There you go. And so you were intact. There was no tear or anything, right?
No.
Are you having any hemorrhoids?
No.
Or swelling, extra pain there?
No.
Good. Okay. Good. I can't tell that from this angle, and I just want to check your bleeding. Then there's not a lot of bleeding. I'm just going to press here.
Mhm.
That's nice and hard. Good. No bleeding. Excellent. So that's where I have to check every 4 hours.
Okay.
Okay? I'm gonna check your legs and feet, okay? All right, relax your legs for me here. There we go. And again. Excellent. Excellent. There's no edema, and I'm gonna check your pulses. Good. Push down for me. Good. And pull up for me. Excellent. All right, so your exam is normal. Let me get your baby for you. Come here, sweetie pie. There you go. Give that to mama. You got her?
I got her.
Okay. All right then. So, do you need anything else in here? Any supplies or anything like that?
No, I think I'm good.
No, you're okay? All right, good. And like I said, I'll be back I'll do that every 4 hours, but you know, Pauline or I will come in every hour or so, and certainly if you need anything, you can call or hit the call bell out, okay?
Okay.
Any other questions or concerns?
What time are the pediatricians around? Because my husband really wanted to be here for that.
Unfortunately, they don't tell us when they're gonna be here.
Oh.
So, normally they come before lunch, but I can't really guarantee. I'll see if I can, check with the charge nurse as to when they're gonna be here. But is your husband coming, or?
He's really close by. He had to run out to go do some work stuff, but he can be back.
Yeah, I'm not really sure if we want to guarantee for if he really wants to see it, but I'll see what I can learn, but there's no guarantee on that if it's really important for him to be here. Okay, anything else I can do for you?
No.
All right then, thanks so much, but good luck to you. Let me know if you need anything.
All right, thank you. Come in.
Hi, Miss McGregor.
Hi.
Hi, it's Kate. I'm your nurse for the day. How are you doing?
Good, how are you?
Good. We met this morning, but it was change of shift and you were kind of tired.
Yeah.
So I hope you're feeling pretty well now.
Yeah, I feel okay.
Good. I'm going to raise your bed because I find it a lot easier to talk when we're kind of on the same plane, okay?
Okay.
How's everything been going for you at the hospital?
Pretty good.
How did your birth go yesterday? Was it a good experience?
Yeah, you know, it's pretty crazy. You know, I'd been pushing for 2 hours. It seemed like nothing was happening, and then all of a sudden all these people came in, so that was a little overwhelming, but it all ended up okay.
Good. Did everybody explain, though, why they were there and what was happening?
Oh, yes.
All right, good. Want to make sure you're having a good experience and you know what's happening. If you have any concerns or questions, that you can speak up and let us know.
Okay.
Speaking of how things are going, though, how's the breastfeeding going for you?
It's okay. It hurts a little bit when she latches, but she's staying on the whole 10 minutes.
Good. And how often has she breastfed through the night?
Every 2 to 3 hours.
Have you had a wet diaper?
Yep.
Oh, good. Okay, so that means she's getting enough. I am concerned, though, that if you're saying it hurts, breastfeeding really shouldn't hurt. So if it is, she may not have as good latch. And if it's all right, I'd recommend bringing in a lactation consultant who can work with you on some positions and help her so that she really learns how to breastfeed and how to latch properly before you go home.
Okay.
Does that sound like a good plan?
Yeah.
All right. Any other goals for the day?
Nope, just want to get that breastfeeding down.
All right, sounds good. There's a few goals that I have. One of the things we do is check your uterus every 4 hours until it's been 24 hours, so until 2 o'clock this afternoon. Want to check that it's hard and want to check that there's not a lot of bleeding coming, okay? Pauline will also be in, as you met her this morning, the patient care technician. She'll be doing your vital signs as well.
Okay.
All right. The other thing that would be a goal really is if you can get up and walk. I know you've gone to the bathroom and back, but if you can take a walk down the hall, you can push the bassinet with the baby. That's going to help, first off, get nice breaths for your lungs. It's going to help your bowels to get moving and with that pain, and it'll help avoid blood clots. Does that sound reasonable today?
Yeah.
All right, good. Do you have any concerns or anything that I need to know about?
Do you know what time the pediatricians are going to round? My husband really wanted to be here for it, but he had to run out. He's not far away, though, so he can come back.
Okay. So I'm not sure exactly what time they come because it depends on their rounding throughout the hospital. However, I can take a look and see if I know who's coming, and if we have any advance notice, then maybe we can have them come see you last and give them some warning. However, does your husband also have access to FaceTime?
Yeah.
So do you think it would be okay if the pediatrician showed up unexpectedly? You could FaceTime him in? Would that be acceptable?
Yeah, I think so.
Okay, so in which case, if you can check with him and see if he can FaceTime, and if the pediatrician comes in unexpectedly, just tell him to stop and let you get your husband on the phone first. They'll be happy to do that, but sometimes people just get caught up in doing and start giving information before you realize that he's not on the phone.
Okay.
Okay,
Yeah.
sound good? All right, I'm going to get my gloves and double check your assessment. We're going to check the uterus and do a quick head to toe assessment, okay?
Okay.
So this is your little girl. I know you didn't sleep a lot last night, did you?
No.
I'm sorry. And what's her name?
Her name's Lily.
Lily. I love that. Okay, so I'm going to put Lily over here just while we do your quick assessment, okay?
Can I hold on to her? I don't want to let her go.
This isn't your first baby.
It's my first girl.
Oh, okay. All right. Yes, absolutely you can hold on to her. Not a problem at all. Just hold on to her now. I want you to hold my hands and squeeze really, really hard. Good. Push and pull. What's going on with it? Why are you grimacing?
My IV is just really pinchy.
It hurts? Let me see. Does it hurt up in here?
No.
No pain there.
Mm-mm.
And it's not swollen. Does it hurt down here?
Kind of, yeah, like right where it goes
Right
in.
there? Okay, but not painful up here.
Mm-mm.
All right, good. So since it's not painful here or swollen, it means it's running properly, and that's good. Generally, if it's, you can have your arm back. If it's right there, it can be right where it goes in, the trauma, and sometimes the tape, it's just the swelling underneath causes it to hurt. I can retape that later, and sometimes just releasing that pressure and retaping it will take care of that.
Okay.
Okay, so we'll try that before I leave, and then hopefully too it'll come out by the end of the day.
Yeah.
All right, good. I'm going to check your pulses on your hands again real quick there. Great. Can I have this arm and you can hold your baby? Good. Relax your arm. I'm just going to check your reflexes. Very nice. And I'm going to come and do this one. You got a hold of her. There you go. Rest that arm right there. Excellent. So, are you having any headache?
No.
No. Any vision changes or blurriness, seeing spots?
No.
Nope. Any chest pain?
No.
Shortness of breath?
Mm-mm.
Do you feel like your heart's pounding?
No.
Good. Okay. Can I listen to your lungs?
Yeah.
So we're going to listen in the back, and I listen on right underneath your gown, okay? I'll just have to slip the stethoscope under. Can you sit up okay? Good. Take a nice breath in and out for me. Good. Again. Again. And again. Good. Another breath. There you go. When you're ready, another breath. Now I want you to take a really, really deep breath here. Excellent. And then I want you to do that again when you're ready. Excellent. Okay. So I'm listening for our crackles, that sometimes if fluid gets built up, especially in the bottom part, the base here of the lungs, that you can hear that, and I don't hear any of that at all. Okay? I'm going to listen to your heart and your heart rate, okay?
Okay.
I listen again, skin to skin, so is it okay if I snap, or I don't want to?
Oh yeah, whatever you need to do.
Good, there we go, that's good. All right, you can just breathe normally. Excellent. Your heart sounds really good. The rhythm and the rate are regular, and I don't hear any extra sounds. All right. So we're going to listen to your stomach next and check your uterus for bleeding. Can Lily be moved over to the side? There we go. I'm going to put the head of bed down, okay?
Okay.
You need to move this back some, maybe, under your neck? Be a little bit easier? There we go. See, the other thing about raising the bed is it's a little easier for me to do the assessment on my old back. I'm going to listen to your stomach, okay? If you could just lift your gown a bit. You don't need to lift up above the breast, just a lower. There you go. Good. I've got bowel sounds in all 4 quadrants. I'm just going to feel, does it hurt if I press right here? No? What about up here?
Nope.
Any pain here?
Nope.
And what about here?
No.
Good. Okay. I'm just going to check your bleeding. If you can bring your legs kind of up like a butterfly. There you go. And I'm going to take a look here and lift this underpants and see how much is there. Good. Now I'm going to just put some pressure here and feel here. No pain?
Nope.
Good. Nice and hard, and I don't see a lot of blood coming out. That's good. Okay?
Good.
I also didn't look like there was a lot of swelling. Are you having any extra pain or hemorrhoids or anything in the perineal area?
No, not that I've noticed.
No. And you didn't tear, I saw, right?
Nope.
Yeehaw!
Yay.
Well, you can keep the ice on, and that certainly helps for the first 24 hours.
Mm-hmm.
And you're okay using all the Paracare bottle and everything that we've set up for you in the bathroom, right?
Yep.
Okay. And no pain on urination?
Nope.
Excellent. I'm going to look at your legs, all right?
Mm-hmm.
So I'm just looking for the swelling. You don't have any swelling, and it looks really good here. That's great. I'm going to check your. Yeah. Oh, there you go.
Good.
Excellent. And I'm going to check your pulses. Nice. So your head to toe exam is very good and nothing concerning. As I mentioned, as part of our goal today is that every 4 hours we'll be checking for that bleeding. If you find you're going through more than a pad an hour, by all means let us know, okay?
Mm-hmm.
If you get up and feel lightheaded or dizzy, stop and give us a call. Hit the call bell, okay, and we'll come for you.
Okay.
Otherwise, I'll come back in an hour and check in and see how you're doing, just so you don't have to call out for me. I have your pain medicine is also about 9 o'clock. You can get your ibuprofen if you'd want that.
Okay.
I recommend the first 24 hours that you just take it every 24 hours, but if you don't need it, you can tell me to hold it.
Okay.
All right? Anything I forgot on the plan then?
No, I think that was everything.
I'm going to talk to the pediatrician, and or find out about the pediatrician, and I'm going to get a lactation consultant for you, and you're going to talk to your husband.
Okay.
Right?
Yep.
All right, awesome. The only thing I want to know is, I want to tell you is I put my name up there on the board with with my telephone number that I always have with me. I also put my charge nurse, Sue. If you have any concerns, if you can't get a hold of me, if you don't like me, anything at all, by all means, you can call Sue. Every unit in the hospital has a charge nurse that you can always escalate care if you don't like something that's happening, okay?
Okay.
And it can also be very overwhelming in the hospital, so if you find that you're not sure, there's lots of tests that are being done on the baby and you don't remember something, call me. If somebody comes in and says they're to take Lily for a test and you didn't remember that, you can call me and say, is this really supposed to happen? Okay? So we can make sure that you know what's going on and what the plan is and everyone's safe. Any other questions or concerns?
No.
Good. Okay, I'll check back on you in an hour. I'm going to put your bed back down because I don't want you to vault out of the bed. and I hope that then you can get some rest, okay?
Okay, thank you.
Sure. Have a good one now.
Thanks.